With the looming threat of a more infectious, more deadly variant, India readies its action plan. The Municipal Corporation of Greater Mumbai has announced mandatory testing and home isolation for all passengers coming in from South Africa, Hong Kong and Botswana. And if found positive, the sample is going to be sent for genome sequencing. The BMC has also announced re-inspection of COVID centres, medicine stocks, production and storage of oxygen, amongst other precautionary measures. Maharashtra Chief Minister also chaired a meeting with BMC chairman yesterday to discuss the new variant threat and has announced penalty for the violators. Kerala government has also made testing and quarantine for 7 days mandatory for all the passengers. MP Chief Minister called for a meeting at 12 noon at his residence with ministers to discuss this threat. Karnataka government has taken stringent measures to battle new variant threat. Nolan Pinto is now joining us live. Nolan, this is a deadly threat that we are all bracing ourselves for. In fact, the whole world is bracing itself for Omicron. That's the new name of the super mutant virus. Alarm bells are ringing all over the world. You're reporting from Karnataka at the moment. What are the kind of measures that the state government is now taking precautionary and prophylactically to ensure that this does not spread?
Well, good morning. In fact, last evening, the Chief Minister had an emergency meeting with senior cabinet colleagues. Now, they've taken a slew of measures to make sure that Karnataka, which is on the verge of an economic bounce back or recovery, does not suffer more. Now, first thing what they have done is stating that COVID-appropriate behavior and COVID measures will be implemented compulsorily and more strictly. Apart from that, they've also stated that all the passengers coming from Maharashtra and especially from Kerala will have to come with a negative RT-PCR test report. Then they've also stated that now, since we have seen a large number of almost about 60 COVID clusters now spread across Bengaluru and Karnataka, what they are stating is that students who have actually come into the state, who are actually doing their medical and nursing in Karnataka, will have to now once more undergo an RT-PCR test. This is what they are stating. Secondly, and most importantly, they have stated that no college events, cultural events, public events, especially in colleges and schools, will be allowed henceforth for the near foreseeable future. This is because in Dharwad, it was a medical college. In Bengaluru, over here, we have a school and we have a college. So They're a little worried that the cases have actually increased for the ages below 25. So these are the measures that they have taken last night.
Nolan, thanks for bringing us this very informative report right there from Karnataka. We'll keep coming back to you for more on this. With the threat of Omicron looming large, here's a look at what exactly different states are doing in a bid to fight this. Let's go with Delhi first. Strict adherence to COVID norms in public places is being enforced. Hospitals are going to be prepared to deal with emergencies again. Delhi LG to hold key COVID meeting on 29th of November. Let's go to Maharashtra now. International travelers are going to be governed by directions of the center. So if you're traveling internationally, you'll have to follow certain protocols. Negative RT-PCR reports or full vaccination certificates for domestic travelers is going to be a must. Passengers from South Africa are going to be quarantined in Mumbai. Then there are going to be samples of these passengers are going to be sent for genome sequencing as well. As far as Karnataka is concerned, Nolan just walked you through it. Passengers from South Africa to be screened in Bengaluru. That's the first step. Samples sent for genome sequences, just like in Maharashtra. Then in Gujarat, mandatory RT-PCR test is going to be conducted at airports. Testing is a must for passengers from Europe, UK, Brazil, South Africa, China and Hong Kong for the moment. This list could increase. In Kerala, mandatory RT-PCR test for international passengers. So all international passengers, 7-day quarantine for international passengers as well from anywhere in the world. In fact, let's get you more details coming in from Mumbai and what Maharashtra government is doing. Pankaj Upadhyay is now joining us for the latest. Pankaj, the Maharashtra government, the last time around in the second wave of the COVID pandemic and even in the first, showed some really good result on ground with strict testing. They were testing a lot. They were testing much more than other states relatively. They tried to contain the situation to the best of their abilities to this time around. Now, as a precautionary measures, as we already know that Omicron proves to be a huge threat, what is it that they're doing in terms of back end to prep up the infrastructure just in case there's another emergency?
Good morning, Chetty. So yesterday, Chief Minister of Maharashtra, Uddhav Thackeray, had an important meeting with the BMC Commissioner, Iqbal Singh Chahal. This meeting was attended by the top officials of the BMC and also of the police as well. In fact, Joint CP Law and Order was also present in the meeting. And after the deliberations of the meeting, it was decided that as far as the Mumbai International Airport is concerned, all those passengers coming from South Africa, Hong Kong and Botswana are going to be compulsorily screened, tested for COVID, irrespective of whether they are carrying a vaccination certificate or whether they have a COVID negative report. They'll be advised home quarantine for 14 days. If a passenger is found positive, he is going to be subjected to institutional quarantine, and a sample is going to be sent to Pune NIV for genome sequencing as well. Also importantly, all the passengers need to know that they need to have their travel history of the past 15 days, because if they are arriving from any South African nation, then their passports and the travel history of the last 15 days is going to be thoroughly put into scrutiny. Additionally, the PMC has said that the discovery and the behavior of this new variant is still being observed. And as and when the Health Ministry or the Government of India issues new guidelines, then these instructions for Mumbai, the airport and the state as such are going to be updated. After the meeting, importantly, Brihan Mumbai Municipal Corporation has said that Mumbaikars need to be extremely careful. As far as Mumbai city is concerned, the Chief Minister has said that all the big jumbo COVID centers need to again see whether they are in a state of preparedness or not, whether they have enough oxygen supply, whether they have enough manpower, whether the electrical and other appliances are working fit or not. At the same time, what the state government has also done, it has said that extra
I'm just going to take the liberty here to ask you one more question. As far as ventilators and other breathing equipment and oxygen is concerned, in terms of the supply chain logistics of the oxygen as well, I hope that the state government in Maharashtra especially, since you're reporting from there, is not waiting until the last minute to sort it out and then work it out with the center, and they are prepared in advance.
Well, Chaiti, that's an interesting question. Taking cue from what happened last time around, because it was seen that there were instances when the state government was taken completely off guard because there was a huge demand and the supply wasn't really matching the demand. So what the state government has done for now, it has already told the various industrial houses and the various oxygen production houses that it has to lay emphasis on the medical facilities first, and as and when the state government gives the direction, the complete focus will have to be on the production of liquid medical oxygen. So the state government officials say that that aspect has been taken care of. From today, what is going to happen is extra emphasis will be laid on COVID appropriate behavior. The fine has been increased. Initially in Mumbai, anybody who was not seen wearing mask at public places was fined ₹200. But from today, the fine is going to be 500. Additionally, if people are seen not abiding by the COVID appropriate behavior, the fine is not just going to be for the individual, but also for the companies, the establishments as well. So basically, the Maharashtra government is saying the numbers are low. Yesterday, it recorded less than 1,000 cases. Mumbai recorded less than 300 cases. And that's only been because of strict implementation of the various COVID laws. And so the state government says that it does not want to
note that the Maharashtra government is really gearing itself up in terms of sorting out the production logistics as well. Liquid oxygen production is concerned as well. And we just hope that the other states follow suit too. Thanks for now, Pankaj, for joining us with that ground report. Director of National Institute of Biomedical Genomics, Dr. Soumitra Das, has spoken to India today on the spread of Omicron variant and the threat that countries around the world are facing. Listen in.
So thank you so much for joining us. Now, there is this new variant that has come up, Omicron. It's been recently named by the WHO, the World Health Organization. So why is there so much panic with regards to this variant? And why is it more transmissible as being stated by international health experts?
Look, Bilan is essentially RNA virus keep on mutating, so this is no surprise. But what is surprising is that in a single variant, we could notice that there are so many mutations has accumulated. So, and that's how that it has created as first interest and now a concern. Because, only the spike protein, which has the receptor binding domain RBD, that spike protein itself has almost 32 mutations. It's a cumulative mutations. But in one variant, appearance of so many mutations in one shot definitely triggers a panic button. But one thing I would like to mention that none of these mutations are actually unique in that sense. All these mutations were actually observed in the other variants. Alpha, beta, gamma, delta, mu, lambda, all these mutations were actually, but somehow they got accumulated in this particular variant, which we now named as Omicron. Please go ahead.
So some are also saying that there are more than 50 mutations. So is it too early or difficult to understand how fast this particular variant is mutating?
See, it's essentially you have to keep on sequencing and see that what frequency they are mutating and which populations, because it all depends. In future, when we have all the sequences done, then probably we'll be able to comment that whether they are actually accumulated and stopped mutating or now they are actually keep on mutating.